Hello, everybody. Hello. My name is Martha Conant, and I represent the Fort Collins Area Interfaith Council on the partnership and also on the planning team for this event. And it's my honor today to introduce our next speaker. Andrew Sharlock is a professor in the Social Welfare Department at the University of California at Berkeley. He holds the Eugene and Rose Kleiner Chair in Aging and directs the gerontology specialization in the School of Social Welfare. And you can read his other credentials in the program. I asked Andy how he got interested in this line of research, and he said that when he was in his 20s, he had an opportunity to talk to a man who was around 80. And he had this epiphany that someday I'm going to be 80. And that has kind of been the guiding light for his whole career. That, along with a curiosity and a desire to ask questions, specifically questions like, why is something done in this way, and how could it be done better so that it would benefit older people? So part of what Andy's research has been along that line. What can be done to benefit older people? And what he will share with us today is best practices that he's found in his work across the United States. So please help me welcome Andy Sharlock.
That's great. Thank you. Thanks, Martha. Really appreciate it. A couple things, but first of all, I don't know about you, but about this point in the afternoon, I start to get a little tired of sitting. So for people who are able to and who want to, if you want to take a minute just to stand up or stretch or wave your arms or do the hokey pokey or whatever you want to do. Now, this business of standing up and stretching and doing the hokey pokey, besides a whole lecture on healthy aging and whatever, is, like most of the rest of my interest in aging, pure, enlightened self-interest. Which is to say, you know, aging isn't about them, it's about us, not just because we are getting older, but because we are aging throughout our entire lives. And from my point of view, because I teach people half my age for the most part, my goal is for them to really get what I got back in my 20s, which was this sort of realization that all things, you know, God willing, I'm going to be there. You know? That back then when I was in my 20s, that God willing 40 years later or so I'd be here. And God willing now that I'm here, I'll be, you know, 20 years older, 30 years older. And that what I do now, at whatever age I am, matters. And it's going to have an impact on what things look like then. And that we have within our ability making choices, making decisions, taking actions both for ourselves and for our communities now that will make a difference later for us as well as for others. So you can all go home now. That's basically, but I got another 42 minutes to fill. So a brief overview of what I'm going to try and do over the next 40 minutes or so. I want to talk a little bit about this whole idea of aging friendliness, age friendliness. I prefer aging friendliness, and what we mean by that and what we're trying to achieve, because that kind of motivates a lot of the whole conversation. We've talked a little bit about aging in place and aging in community. I want to underscore some of that. I want to talk about picking up on some of Elizabeth's concepts, the idea of what we call structural lag, which is basically the idea that our environments and our attitudes don't keep up with the realities of our lives. That we are trying to squeeze our own lives and our own aging in, for the most part, not this place, because this is a great place, but into environments that were not designed. In fact, they were designed for some previous generation's idea and experience. of aging. And so thinking about what we can do about that, this whole international movement on creating aging-friendly cities, they don't talk about creating aging-friendly counties, but they talk about creating aging-friendly cities. But the implications are very clear. I want to talk about some examples from there. I want to talk about some examples from what we call cross-sector collaborations between transportation, housing, urban development and urban design and the like, and health, and some examples of things that are being done. I want to talk about community development initiatives, groups of people at the community level who are getting together, creating new kinds of initiatives. I want to say a word about the idea of virtual communities, about the role of technology. We haven't talked a lot about it. It came out a little bit along the way. Elizabeth made a couple of comments. I think that there are some emerging technologies, maybe just because I'm coming from California and all, that are really have a lot of potential to transform some of the challenges that we're experiencing today. And then just finish with some challenges and opportunities. So that's sort of the sketch. One of my favorite guys, I've forgotten his name actually, but at the bottom here it says, "Growing old is not for sissies." The time this picture was taken, this was a 75-year-old living in Marin County, sorry. But, you know, this is sort of like one image of aging. I put it up here, and I really hate the notion of successful aging. But I put it up here to suggest that there's lots and lots and lots of different ways of aging. And for me and half the people in this room who are baby boomers, you know, the whole issue that, you know, back in the 60s and rock and roll, well, you know, rocking and rolling, there's all different ways of aging. And the question that we brought up by a number of people, starting with Sandy this morning, of how will we, whatever age we are, whatever age cohort we are, how will we age? How do we want to age? And how are we going to make that happen? 15 years ago or so, the G8 labor ministers got together in Italy, in Torino, Italy, and they had this meeting, and the meeting, part of the meeting was about what are the implications of the aging of society for labor markets. And there's a lot of hand-wringing and, oh my God, who's going to care for all these old people? And we're going to have all these old people and nobody in the workforce, et cetera. What was interesting was at the end of their meeting, they came up with a charter, and three of the principles of the charter: the aging of our societies will create new opportunities as well as challenges. There's nothing inevitable about the impact of aging on society. We have the ability to change what we do to accommodate the changing demographic realities. And older people represent a great reservoir of resources for our economies and our societies. So it's real interesting, the transformation in the thinking of these labor ministers from seeing aging as a problem to seeing aging as a possibility. And I'd like to suggest, as we continue to think together, to balance those. Okay, so I want to talk about the whole idea of aging-friendly communities, and I prefer the term aging-friendly, primarily because, as really going back to what Sandy was talking about this morning, the idea that we are aging, all of us, you know? We're aging from the time we're born, before we're born, and we continue throughout our lives. So aging is not the province of one age group or another, or one age cohort or another, or birth cohort or another. It's part of the life course. The interesting question is, what happens as we get older, and what are some of the challenges and unique features? So a survey that N4A did a number of years ago, one of the things that it asked was sort of, what do aging boomers want? What do baby boomers want as they get older? And what's interesting about this, and see if this fits for you, I think this is something we all want at any age. It's not aging. We're not talking about aging here. We want to remain where we want to live, where we want to live, in our own homes and neighborhoods. We want to be able to stay in connection with friends, with family, with our social networks. We want to get to places we want to go. We want to be safe, want to be healthy, want to be involved. This isn't just the business of aging. It's the business of life, right? And as we talk about the concept of community and connection to community, I begin here because it's important to think about why are we trying to create aging-friendly communities? Why are we looking at community change? It's to help us be able to do these things, and it's to overcome some of the barriers, age-related many of them, that make it harder to do these things as we get older. So in that perspective, at Berkeley we've come up with sort of some 6 sort of principles of aging, drawing upon the evidence base in psychological development across the life course. And I won't go through all the research and empirical background for all this. Number one, a friend and colleague of mine, Sharon Kaufman, she wrote a book 30 years ago now called The Ageless Self, and it's real interesting. Her research, she went and interviewed a lot of older adults, and she wanted to find out, what does it feel like to be old? What's the experience of aging? What do people think about? What do they talk about? And what she found, not a big surprise, is that people didn't define themselves primarily based on their age. That when they got up in the morning until they looked in the mirror, they didn't think about themselves as being a certain age. And I will tell you, honest to God, when somebody asks me how old I am, I literally, it's probably early to mention, but I literally have to, I know when I was born, and I know what year it was, and I got to subtract one from the other to figure out how old I am, because I don't, off the top of my head, feel or think, or I don't know, of how old I am. That's just not what's most present for me. For the most part, and there's a lot of evidence from this in terms of personality psychology, we stay pretty much the same people we've been throughout our adult lives. The things that have been important to us, they change somewhat, but for the most part, they stay the same, et cetera. So what we want, number one, in terms of aging-friendly communities, is we want communities where just because you're a certain age or because you got gray hair or whatever, or wrinkles or this or that, doesn't get in the way of you continuing to be able to do the things that are important to you. That's just very simply number one. Number two is a recognition that, well, yeah, there are some aging-related changes that occur. They can occur at any age, but some of them occur much more likely as we get older, that do make it harder. And so we need some compensation. We need some accommodations. We need something to kind of hold on to. It's real helpful to have that little banister there, that little handrail to walk down off the stage. None of you were there, but I actually fell off the stage at a major conference a couple of years ago. I just was running up and down the stairs like a kid and missed a step, you know? So could have happened at any age, but it's more likely to happen when I'm 64 and balance is not quite as easy and the feet kind of, you know, trip a little bit more easily. And sometimes we need a little assistance, some support for some basic safety and security. So that's the compensation. And a lot of discussion about aging ends there. But what we also want to think about, control, being able to have some choice over what happens to us. It's what we value the sense of independence and autonomy. None of us are 100% independent, 100% autonomous. We all, you know, it was just tax season and many of us hired somebody to help us with our taxes, or you pick a million different things that we get help with. We want to be able to make those choices, to control, to have some choice over where we live and how we live and the conditions of our life. And that becomes more important as we get older. Connection. My colleague Laura Carstensen at Stanford, she did a lot of research that shows that as we get towards the end of our lives, of almost anything, we invest more in what we have. So you can try a little thought experiment. This works actually for college students as well as it works for those of us a little bit older. I do it with my college students. You know, as they get closer to graduating, are they going to spend their discretionary time? They tell me they don't have any, but I know they do. Are they going to spend their discretionary time going out and meeting lots of new people and doing lots of new things? Or are they going to invest that time in the people they already know and care about and deepening those relationships and really having more of a sense of positive social engagement and emotional support with the people they already are connected to? On average, for the most part, you invest in the people that you have the deepest relationships with. And that goes on, that's also true as we get older. So that sense of connection and strengthening those interpersonal bonds becomes important. But it also gets harder as a result of disabilities and environments that make it harder for us to connect with people, to see people who have been important to us. we continue, and as some people would argue have an even greater need, to feel like we matter, to feel like there's a reason to get up in the morning, to feel like at the end of the day, literally the 24-hour day as well as the more metaphorical day, our life has mattered, that we've had some impact on the world around us, we made some contribution. And finally, something that we oftentimes really forget because we're so focused on safety and protection and all, at both the cellular level and the organismic level, the idea that we need to put out more energy as we get older to keep things functioning at the same level. And we need to challenge ourselves. We need to be stimulated. We need to be energized. And we need to be energized, we need to be challenged, and we need to have environments that don't overwhelm us, but provide enough stimulation so we feel alive. Okay. So that's background. Now, I want to differentiate aging in place and aging in communities. Theme we've talked about a little bit already today. Bill Thomas was mentioned, a friend of mine. Also another friend of mine, Janice Blanchard. You know Janice Blanchard? She was the former head of the Department of Aging in Denver, I believe. Yep, okay. So they came up with this model, and it's real interesting. They argued about the idea of aging in community. And what they said is, we oftentimes think of aging in place. And aging in place is all about, I'm going to live in my home, and as I need more help, you are going to bring that help to me. You're going to bring Meals on Wheels. You're going to bring in-home care. You're going to bring the kind of things to help me continue to live where I'm living and avoid ending up in a nursing home. Okay, that's good. No question about, I'd like you to do that for me. But what really matters is still being connected to the community, being part of a community, being involved. Because at the end of the day, it's those social connections that really matter. And just because you reach a certain age, or just because you have a certain level of disability, does not excuse you from having responsibility, not only for yourself, but for your community. That throughout our lives, our environments, our social environments, our physical environments, have some responsibility to us, and we have some responsibility to them, and it doesn't stop just because you've retired, just because you've turned 65, just because you're disabled. I'll talk a little later about the village model, and I know we've got some representatives here from the village movement. There's a village in Southern California, and there's a few others around the country too that do this, where they have people who are disabled and who really have trouble leaving their own homes, who are contributing members of the village or contributing members of time banks, which I'll mention also, because they do stuff by phone or over the computer, over the internet. Just because they're stuck in their homes doesn't stop them having a role to play. Okay, so that's the idea of aging in community. And sort of for the research types, in my work we've come up with this, what we call a logic model. Basically the idea here is we want to do three kinds of things in our communities. We want to help people to access services, and we also want to enhance services. We want to build a sense of community, a sense of connection, a sense of mutual responsibility, ways of working together, and also we want to promote elder empowerment, which is to say we want to find ways to help hear and use the talents and the voices and the resources of people who may have trouble sharing those for a variety of reasons. And by doing that, we can enhance individual capacity, the physical, psychological, social well-being of individuals, but also we can look at how we can enhance community capacity, how we can build the social capital, as it's called, the sense of trust, the sense of connection, the sense of being able to access help when one needs it, the sense of intergenerational bonds, and also we can improve the service delivery system. Now I know a couple of people sort of danced around the issue of the private sector and service delivery, et cetera. I argue that if we, based on pure enlightened self-interest, start to advocate for the kinds of services that we want and need, the kind of products we want and need, and frankly, if we're willing to pay for them, then the market will respond. In my local newspaper, about twice a week now, there's full-page ads for a variety of quote-unquote mobility products. Now, I mean, you know, walkers and electric chairs and I mean, a whole variety of things. 10 years ago, you would never have seen that. If you go, I don't watch a lot of television, but look, when I'm at the gym and I'm watching TV, I betting half the products, at least, that I see on television are designed for people over a certain age, including Viagra, please. I mean, really, you know? You can still keep, you know. And you know, no money out of pocket, you can have that easy go chair or whatever they're called. I mean, right? I mean, we're starting to see advertisers advertising products because there is the power of a marketplace. So we as consumers need to be clear about what it is that we want and advocate for it. So when we talk about housing, we need to be willing to move into a house, not just with how will it be a good place to live now, but is this the kind of place that will be good as I get older and as I have a little more trouble with stairs, or as it's harder to bend down or harder to get on a stool to reach up or whatever? Does it have the, what we call universal design, does it have the flexibility so that I can, without tearing down the whole place, I can make modifications so that it can still be a good place to live? And am I willing to pay a couple of dollars extra to have that? Am I willing to pay a couple of dollars extra for somebody to put in an extra stud when they put in the shower enclosure, so there's a place to screw in a grab bar and actually put it in the plan and keep the plan somewhere so I don't forget where it was and you can always find it again. But, you know, I mean, how much is the price of a stud when you're building a house? How much is the same price to install a grab bar to retrofit? Think about it. And yet, we don't even ask that question. Okay, sorry, going to my soapbox. Okay, as we talk about aging-friendly community domains, we talk about the hardware and the software, sort of the physical environment, the social environment. Frankly, it's not so simple because, you know, like transportation. Is transportation, you know, the built environment, or is it the social environment? The answer is it's both, because it's how we design our roads, it's how we build our cars, it's how many buses we have, but it's also who drives them. It's also all the supports that go with it. But anyway, it's a way to sort of think about the world. Okay, so I talked about structural lag. I'm just going to show you some pictures and then get on to some lessons that we're learning. So part of the problem is that we are so madly in love with our automobiles, and by we, I mean people of my generation. I know, Little Deuce Coupe and all that stuff. I mean, we should. This would be a good party thing. Go to a party with a bunch of baby boomers and see how many songs you can come up with that have cars, you know. And all right. So you know, you go to Nevada and you got drive-through weddings, but as if that's not enough. Then we have drive-through funeral homes where you drive up to the window and you pay your respects, you know, because we're in such a hurry and we don't want to get out of our cars. And then we have, you know, all the drive-through, the ATM drive-through, and then of course, if you look closely on the buttons, we have the buttons, you know, with Braille on them for the blind drivers. I mean, I know it's the same keypad and they just plop it wherever, but you know, it's like, use a little thought. And I don't know about you, but the bank where I bank, the way the drive-through is set up, I mean, I would have to go to the chiropractor immediately after driving through to use it, because the kind of stretching and maneuvering, I'm not going to do it here because I will end up at the chiropractor, and I've still got to sit on a plane tonight, that is just ridiculous. Whoever designed these was not thinking about somebody my age or older. That's for darn sure. And that's part of what all this is about is just when you design something, think about who's going to use it. And think about who's going to have trouble using it. Okay, some of you remember these guys. This is, you know, Abbey, cover of Abbey Road. Well, you know, it's walking across Abbey Road's gotten a little different, takes a little longer. Some smart person about 10 years ago did a study. This was in Connecticut and in New Haven. And they timed the cross signals. Now, a lot of this has changed now, but they timed the cross signals, and then they did a very interesting little study. They basically looked at the average, the median walking speed of somebody over the age of 65, and they found that the majority of people over the age of 65 couldn't get across the majority of the crosswalks in time. Now, you know, we've gotten smart. We have countdown crosswalks and things that really help a lot. And in San Francisco, we're pilot testing some crosswalks where there's little infrared sensors so they can tell whether there's somebody crossing somebody in the crosswalk or not, and they can delay the timer accordingly. Now, I know from the point of view of drivers, this is a pain in the butt because you're sitting there while, you know, somebody is walking. But look, because I've been in both places. Look, for you sitting in the car, it's another 15 seconds, 20 seconds. You're going to get wherever you're going 5 minutes later. It's probably only 20 seconds later, but I'll give you the break. 5 minutes later. For that person, it's all or nothing. It's whether or not they're going to try and cross the street, whether or not they judge that it's worth even trying. And pedestrian fatalities among people over the age of 65, it's the highest risk group for pedestrian fatalities. It's also, by the way, the highest risk group for automobile injury and fatalities. And so, you know, we talked about that earlier today. So as we get older, we're so attached to our automobiles. As we get older, many of us have thought, well, so I'm sorry, Mom, I'm sorry, Dad. It's gotten to the point where, you know, you've gotten in an accident or you're not safe driving, we're going to have to take away the keys. And I get it. There's no question about it. We need to be thinking that way. But how about before we take away the keys, we ask, what would it take to make driving safer? And yes, I know there's the AARP 55 Alive driver's training course and stuff, and I got 5% off on my car insurance by taking one of the classes once, and I decided I wasn't going to do it again because it wasn't worth the 25 bucks to take the class. But honest to God. But how about the fact that one of the major places for automobile accidents for older adults is left turns. What can we do to improve the signage and the lane change business for left turns to reduce the risk of automobile accidents? One of the big problems as we get older is flexibility. It's both peripheral vision and just flexibility, being able to look. Well, what does it take to put those little extra infrared sensors on mirrors, or have those extra little pieces on the side, on car side mirrors, so that you can see, so you can see through the blind spot? Now we have cameras behind us, you know, and so we can see backup cameras in cars, so that you don't have to be able to, you know, be an owl and turn your head 180 degrees. Things that were not really designed really for aging, but are going to make so much difference. So let's begin by looking at how we can redesign what we already have so that we don't have these problems. And then if at the end of the day there's no way to fix things, take away the car keys. But before we take away the car keys, let's look at what other options there are. And at least in California, where we got the home of Uber, and we got the home of Lyft, and we got the home of Google self-driving cars, autonomous vehicles as they're called, maybe you don't have to take away the car keys. Maybe you just buy a car that drives itself. Within the lifetime of pretty much everybody in this room, we're going to have cars that drive themselves, at least around town. We talked already about the problems of deferred maintenance and the impact of this. This is a house of a colleague of mine, and yes, it has about 1 million steps, and we buy houses because we think of how they are now. We don't think about what it's going to be like later, and so we end up like this couple. The guy says, so June, do you think we should get a stair lift or just move to a bungalow? Because let's face it, we're getting old, and there'll come a point where you won't be able to carry me up the stairs anymore. And most of my career has been studying caregiving. And this is funny, but it's not so far from the truth for many of us in terms of what it takes to try and take care of a loved one, a spouse, a partner, a parent who needs help, when we're trying to help them stay in their own place, especially when the place was not well designed for us as we get older. We have great services, great in-home care, et cetera, and yet study done by some friends and colleagues of mine. They looked at unmet needs among people with disabilities in the United States and in Sweden. And if you look at instrumental activities of daily living and personal care activities of daily living, and then just any ADL. So if you look at people, older adults with disabilities who have any kind of IADL or ADL impairment, in the US, more than half of them have some kind of unmet needs for care. In Sweden, less than 5%. There's something we're doing wrong here, folks. I want to spend the rest of the time talking about some examples of aging-friendly communities, some things that are being done around the country that, you know, not better, not worse, but just some things to be kind of thinking about. Some of them I've been involved in, some not. I'll begin by, we did some work, a couple of former students and I, a couple of years ago. We looked at aging-friendly initiatives around the United States, and we kind of categorized them. It's kind of, you know, sort of academic, but and the distinctions are not as clear as this would indicate. But one group, about 1 out of 5 of these initiatives around this around the United States, we categorized as sort of community planning initiatives. They're where people in government, typically, sometimes the AAA, sometimes foundations, they serve as conveners. They get a bunch of people together and they say, okay, let's do some kind of needs assessment, a community survey, some kind of needs assessment, might be focus groups. Let's figure out what do we need to do in this community, and then we'll create a plan. Now, I got into this whole aging-friendly stuff because I was the lead person on the California State Long-Range Strategic Plan on Aging about, I don't know, 12 years ago or something like that. We developed this great plan. It had, I think, 215 recommendations, prioritized. We have 15 high priority recommendations. For each recommendation, we indicate what the role of the private sector, the public sector, local government, the nonprofit community, education, business, and short-term, medium-term, long. We had this great plan. It was wonderful. Nobody's ever heard of it. Well, nobody. Hardly anybody's ever heard of it. Why? Because it was a great plan, and it happened that the governor that was done for got recalled 2 weeks after the plan came out, which didn't help matters. But planning is important, but it's not enough. So how do we implement it? So I'll give you a few examples of some community planning efforts that are really doing a nice job and really doing a good job of implementation. Another group are what we call cross-sector systems change. I mentioned that already, housing and transportation, healthcare and all, coming together in new ways, creating new kinds of structures, new kinds of systems. I'll give you a couple of examples of that. What we call residence-based support services, which are really just an application of this cross-sector, where we have housing providers and healthcare and social services coming together. And then what we call consumer-driven support networks. These are the villages and other kinds of models where there's consumers, kind of grassroots efforts. And then what I'm not going to talk about are what we call single-sector services. This is where something's being done just in transportation or just in housing. But it's not really what I think of as real comprehensive system change. So these kind of community planning initiatives, how many of you have heard of the World Health Organization's Global Age-Friendly Cities and Communities Initiative? Not a lot. Wow. Okay. So there's now 210, 220 communities around the cities and towns around the world who are part of this. The first one in the United States was Portland, Oregon. The second one was New York City. In the United States, AARP has taken the lead, and there's about 45 or so cities and towns in the United States who are part of the AARP network that's part of this global network. But all over the United States, cities and towns are becoming part of this network. It really is all about saying that you as a city, as a town, as a county, as a community, want to become more aging friendly, coming up with a plan and coming up with a plan for implementation and doing something. It can almost do anything, but you need to have some tangible thing that you do. New York is just, you know, it's one of my favorite examples because what they did was a partnership between the mayor's office and the New York Academy of Medicine and local community districts. They took 3 of the neighborhoods in New York and made them aging improvement districts. Aging improvement districts. And in each of those districts, each of those neighborhoods, they brought together pretty much everybody. They brought together older adults, they brought together nonprofit providers, they brought together local businesses, and they sat down together and they said, what are some things we could do by the way, in parentheses, with no money from the mayor's office, that could make this community a better place to grow old. And there's silly little things like benches on the long blocks for somebody to sit and rest, or in the I don't know what you have here in CVS or Walgreens or whatever, when you're waiting in line for to get your prescription, to have somewhere to sit. Or the local community pool, swimming pool. Some of the older adults were saying, you know, we want to get exercise and we want to go to the pool, but when we go there, we're kind of afraid. There's all these kids running around, and we're just overwhelmed. So how about in the middle of the day, when there's pretty much not too many other people around, having an hour a day that's just sort of time when seniors have first dibs. You can swim any time you want, but you know that if you go during those times, you're going to have the place more to yourself. Little things like that. But the point here is that each neighborhood said, what do we want? What do we want? All we want is some facilitation. All we want is some political capital to make this happen. In Atlanta, Sandy earlier mentioned Atlanta, Aging Atlanta. It's one of the whole effort there by the Atlanta Regional Commission is just really a model, because what they did, they have a model now where they say aging in everything, and where they looked and they took their whole regional plan and they recast the regional plan from the perspective of livable communities. They built that into the very nature of their regional plan, and that then drives doing the charrettes to get neighborhood folks together to look at a particular how they're going to use land for the benefit of everybody. It drives looking at transportation and how to bridge across the barriers that go from one city to another, or one town to another, et cetera, et cetera. And then I want to talk about some of these cross-sector initiatives that really are about reinventing senior services. I'll share a couple of them with you. Talking about rural, Aging with Aloha was a community partnership in Maui, county of Maui. It's also the island of Maui, in Hawaii. And Aging with Aloha was very interesting because they brought together pretty much everybody who touches older adults in Maui. And they said, you know, your client is my client. How do we work together? How do we transform what it means to get old and transform the kind of supports that are available? And how do we reawaken the sense that aging can be something positive, and that older adults in our community are like they used to be, a resource? How do we re-engage older adults as an integral part of our community? And then Care for Elders, which is an initiative in Houston, very interesting. They did the same thing in terms of public education, in terms of information referral, in terms of care coordination. They did a couple of other things that I thought were kind of special and kind of unique. One of them is they have a whole bunch of what we call chronic disease self-management programs, health promotion programs, geared to arthritis, geared to falls prevention, geared to depression, to help people better manage some of the normal or not so unusual challenges that we experience in our health as we get older, to help us stay healthy so we don't need to have those expensive doctor visits, et cetera, and hospital visits. The other thing they did is they have an annual summit like this, except it's a little more interactive, that brings together care providers, both family caregivers, but what's really, oh lovely, what's really innovative is they bring together, thank you, they bring together the care providers, the people who are getting paid not very much to provide care. And they say, what have you learned this year that we can all learn from? How can we help one another? This is also another one in California where many parks in California are very, very diverse, both in Northern California and Southern California. And this is a community that decided that what they wanted to do is they had a lot of people in ethnic communities that were really not using the majority culture services, the dominant public services. And so they said, rather than the continual conversation about how do we get those people to use our services, how about if we use our resources and hand them over, essentially, to people, to the elders in those communities, and say, how can, and so they brought together appointed elders from each of the ethnic communities, and they created an elders council, And they said, okay, we're going to meet monthly. You are going to tell us how our public resources can be better used in your communities and how we can help support you in helping your own community. One of my favorite examples, Hotel Oakland. It's an old Grand Hotel in Oakland. It's now affordable housing, low-income senior housing, Section 8, and HUD 202 housing. About 350 units. When you walk in the door, it has a big sign that says Hotel Oakland Village, and because 90% of the people who live there are primarily Chinese speaking, it has this those characters there, which I'm told mean participation equals good health. And the whole building is based on the principle of how do we build health promotion into the very nature of life here. Hope Meadows is a planned intergenerational community where you have older adults and younger families. Most of them are foster families with dealing with kids who have a whole bunch of problems, coming together to help one another. The older adults get subsidized housing in order to put in 20 hours a week to serve as quote-unquote grandparents for the young folks. And as time goes on, the older adults need help. They have adopted families who have a responsibility to help them. Okay, I won't spend too much time talking about villages. How many people know what village movement is, village model? Not a lot. Wow, okay. Well, here's the basic idea. There's about 150 of these in the country. They are doubling every 2.5, 3 years. They are grassroots community initiatives where a group of older adults sitting around a table in somebody's living room or whatever get together and say, you know, I'm getting a little worried about how I'm going to continue to take care of myself. So are you, so are we. And plus my friends, you know, it's hard to get together with them, etc. We create our own little mini community, but we keep living where we're living now. So we don't move, but we have our own sort of social support network, and we put in a little bit of money every month to pay for some person that we can call. So when I need a light bulb changed, or when I need somebody to reprogram my remote control, or when I need a little help with the computer, or when I need a ride, I call up this person and they arrange it for me because they have a whole slew of volunteers that they can call on. They might be members of my group, my village. They might be other community members that they can call on to help me when I need help, or to shovel my driveway or my walkway or whatever it is, so that we're there for each other. But you know, the number one reason why people join villages is not for those kinds of services and things. It's for the sense of security and the sense of community. Because what it provides is a sense that you are part of something. And by the way, just FYI, for the aging-friendly Larimer County, I would suggest you consider getting badges or getting hats or shirts, or maybe you already got them, or something. Because there's that sense of identity. There's a sense of being part of something. We did that in Contra Costa County, where I live, and where you go around and you go to public events, and there'd be people with these pins, and somebody would come out, oh, what's that pin all about? There is something about being part of something that's really important throughout our lives, and especially as we get older. Here's where the villages are around the United States. I won't spend much time with this except to say that the role of technology is critical. And I ask you, think about the things that are important to you and how technology can make a difference. So that when we talk about social connections and social support, there's, how many, do we have Nextdoor in Fort Collins? Yeah, how many of you are on Nextdoor? Okay, Nextdoor is a website, it's an internet connection, it's a listserv where you and the people in your neighborhood are all on the same little listserv. And so when somebody moves in, they can announce it on, you know, welcome Sally and Joe Smith who moved to such an address. Or has anybody know a plumber? I need a good plumber. Or I found this little kitty. Does anybody know who belongs to this little black and white kitty, or whatever? It provides this sense of connection. Ties is one of many internet sites that provides a way for people to connect socially and to provide and coordinate caregiving, and for people who live all over the country, even all over the world, who share a common interest or a common family member who they're concerned about, to connect, to discuss, to coordinate. And then finally, one of my favorites, we talked earlier about senior living environments. There's a very traditional continuing care retirement community, a very traditional multi-level senior care facility in Southern California, which looked at the future and said, you know, the future is not about purpose-built, bricks and mortar communities like the one that we have. And so they created something called Sherpa Life. And I encourage you, whether or not you want to join or not, whether it's not for you, go online, look up Sherpa Life, because, by the way, this is the little icon for Sherpa Life, and Sherpa Life is a website where for $79 a year or whatever it is, you can connect with other people, you can find out, you can get help with accessing services if you need them, you can connect with people who have similar interests, you can plan trips together, they have products, they have life planning, they have life coaches, all kinds of things. The idea that these people had was, you know, rather than trying to figure out how to get people to come where we are, let's see how we can help meet people's needs where they are. And I think that's part of what's happening throughout the country. So putting it all together, I won't spend too much time. One of my favorite examples is in Seattle. Aging Your Way in Seattle is started by a community organization, a nonprofit community organization. It combines pretty much everything. They've got a time bank. They've got a village. They've got lifelong learning. They've got volunteer transportation program. They've got co-housing. They've got community-based health care and health promotion, et cetera, et cetera. So it's one of my favorite examples. It's called Aging Your Way. It's in Seattle. All right, just to finish, this is from former UN Secretary General Kofi Annan, back 15, 17 years ago, talking about the UN Year of Older Adults, a society for all ages. A society for all ages is multi-generational. It's not fragmented with youth and adults and older persons going their separate ways. Rather, it's age inclusive, with different generations recognizing and acting upon their commonality of interest. Okay. That's how I got into this business 40 years ago or whatever it was, because somehow, whether because of my grandmother or whatever, sitting down with that 80-some-odd-year-old person in that nursing home, I had this realization that that was going to be me. And that maybe not only did I have some responsibility now for him, but I had some responsibility now for me to become the kind of him that I wanted to become, and to transform our environments to be the way we want them to be. We have that power, and I really encourage you to go forward with that. Peter Drucker was quoted as saying, the best way to predict the future is to invent it. You are in the process of inventing an aging-friendly Larimer County, an aging-friendly Fort Collins. Kudos to you for participating in that work. Go for it, and I look forward to continuing that process with you. Thank you.
So, we have the pleasure of having two experts up here on the stage, and we're going to open it up to questions for the audience and comments for them.
Do you see an Uber-type service as a benefit to seniors?
Oh, do people know what Uber is? How many people know what Uber is? Okay, some people don't. Yeah. Uber and Lyft, there are a number of private, oops. Yeah. There are a number of transportation systems that are being developed around the country, various flavors. The idea of Uber is you register online. There are Uber drivers and Uber passengers, and you can be one or the other or both. And if you want to go somewhere, you call a cab. Well, instead of calling a cab, you basically go online and you find an Uber driver who is in your area, and you indicate where you are and where you want to go, and you are electronically matched with somebody in your area who's willing to drive you there for a price. So that's how it works. It's basically taking the idea of taxi services and making it much broader so that you have many, many, many more drivers than you would. There's some controversy about that, and the taxi cabs are not exactly overly thrilled about the whole idea. In the San Francisco area, there's something called Silver Ride, which is basically that idea geared for older adults. A couple of former students from Berkeley put it together. I never thought it would go off the ground, and it is absolutely going swimmingly. Why would you call Silver Ride rather than just calling the local cab? It's very simple. Because you call Silver Ride and you get somebody, number one, you can ask for somebody by name. Number two, you get somebody who doesn't just treat you as a fare, but treats you as a person. They come to your door, they escort you out if you want to be escorted out. They talk to you. They haven't, I mean, it's like one human being to another. And a week later, or 2 weeks later, or a month later, when you need to go to the doctor again, you call and you get the same person. So you feel like you have a relationship. Anyway, so there are some interesting things being developed that are really about transforming those kinds of business relationships into social relationships as well.
Well, and I'd like to build on that. Do you all have the cars that you rent by the hour? We call them in DC zip cars. Well, I want you to think about this because we, through the National Senior Center for Senior Transportation, it's late in the afternoon, my time, that N4A runs with Easter Seals, we give out grants to communities across the country. Small grants, but grants that really seed innovation. And one community picked it up and used these hourly rental cars. You find them in a lot of areas where there's universities or urban areas where people don't really want to have their own car. And what happened in this instance is they ended up having people rent those cars and use them to transport an older adult to either the doctor or any other place that they wanted to go. For that time that they donated to do that work, then they got credits to be able to rent that car for a longer period of time at a lower or no cost. So again, it builds on the same idea that Andy's putting forth, is that, you know, look at what exists or might exist in your community that really fosters the relationships and doesn't necessarily require you to build entirely new systems.
Thank you so much for your thoughts. They've been just extraordinary. It seems to me that a lot of the programs and services that are provided inadvertently create a sense of dependency and entitlement. I don't believe it's the intention, but I think it's perhaps the way they're delivered and perhaps the historical context. I'm wondering if you could comment on how we can provide services to essentially ourselves, because we're all there, in ways that do not do that, but rather foster independence, a sense of confidence. I can do this. How can I help?
So I'll take a stab at it now.
Okay, sure.
Because I know that a lot of the focus on N4A and area agencies on aging are dealing with that as well. You know, that honestly, that's why I'm doing what I'm doing right now, because I really believe there's no way that we're going to be able to have the kind of both the money as well as the human power to provide the supports that we need as we get older. And, you know, back to that slide I put up much earlier, the issues of control and really being a whole person are really important throughout our lives, especially as we get older. So it's one of the reasons why I'm very interested in villages, the idea of people coming together and saying, how can we use our resources, what we already know and what we can do to help take care of one another and take care of ourselves, and creating structures to be able to do that. One of the mantras, and Arnie and others maybe can speak to this, one of the mantras in sort of the village movement is we don't want to be like those social service organizations. We don't want to be a client in that kind of way. We don't want to be subservient in that way. And remember, my day job is training social workers, right? We need to transform our service systems so they put people first, and we use the services to support people having what they want and feeling a sense of control and empowerment without losing sight of the fact that there are some folks who need a little more help than others, and that we live in an environment where our structures are not well designed for us as we get older. So part of our effort needs to be not just taking care of ourselves, I believe, but also working together to create the kinds of environments that are better places for all of us as we get older. But I agree 100%, whether we're thinking about senior centers, whether we're thinking about social services, whether we're thinking about the public sector, how do we reconceptualize things so they're empowering and not disempowering, but also supportive when we need help. So, yeah.
Well, and I'd like to follow up on that because I agree with what Andy says, but I think that the entire social services system, the work that is done through the Area Agency on Aging, and again, you have a fabulous Area Agency on Aging here in this community. But in saying that, we're redeveloping our systems as well, and have been really since the systems were created. We've added more services and supports to them to meet the needs that have been identified at the community. But to your point, I think the evolution that's going on right now and that we're really working to spearhead is recognizing that there's a lot of factors going on. One is an increasing aging population, so the demand for services and supports is going to vastly increase. And if I gave you a chart showing you the investment in the Older Americans Act, the Federal Older Americans Act, it is flat. So despite the fact that the population is going like this, the amount of appropriations for services that are delivered to help people stay in their homes and their communities, apart from Medicaid, so that means if you don't want to spend down on Medicaid and you need home and community-based supports, that the federal funding is relatively flat. So that being said, what we're doing through the Area Agency on Aging system, and we're launching forth into this, is really looking at ways to develop a whole new service system that builds on the foundation of the services that have been provided for 40 years. Part of that is, one, person-centered services. What do I mean by that? That means that instead of telling you that these are the services that we have and based on your needs here, we're going to give you these services. No more. We say, these are the, what are your needs? We've done an assessment and these are what we think your needs are, but what do you think your needs are? How can you meet your needs with the informal system that you have? And then how can we fill the gaps to help you meet those that you can't fill through your informal system? The other part of that is, and I'm here to tell you, you may have to pay for them because there is no way that the Area Agency on Aging or any of the providers in your community are going to be able to provide the level of services and supports that are needed with just governmental funding, whether it be federal governmental funding, state governmental funding, or local governmental funding. So I think we really need to look creatively and innovatively at how we deliver services in the future, and I think that that's already starting and begun now.
I did want to add something real quickly to that. About funding, and I don't know if Joanne, Janelle, and Jenny Orange are still here, but I just want to send out a big thank you. While our federal funding for our AAA has been flat, the state of Colorado has really stepped up to the plate, and we really do need to thank our legislators because they have recognized that, and they have stepped up to the plate, and they have appropriated more state funding than they ever have before, and so we really do appreciate what our state is doing.
Thank you so much. I feel like we're all kind of filling our cups up today and getting inspired. I have a question. You know, in a society where I feel like we're raising children to be consumers and not creators, what opportunity have you seen that have allowed for people in our community that are retired to teach our children to be creative, to be productive, not just in their community, but in their homes, so they know how to fix stuff? And
I'd like to have people fix stuff. In saying that, I think that what you've hit on is, again, the value of intergenerational activities. And again, the value of not separating the generations into age-segregated types of settings. And in saying that, it's interesting when you said creative, because in some ways what I am seeing is the creativity of young children today and young adults in the technology area, and how that is transforming and being transferred to older adults, again, however you define that. And then on the other hand is the more tactical skills that older adults grew up with, fixing cars, fixing, being able to use a hammer and a nail, which some kids have never used, and to be able to transfer that. So I think what we need to do is to figure out how we do a skills transfer and to have that part of a community learning. And how cool is that? I mean, how cool is that? Because how often do people, I don't know about your kids, but my kids look at me and go, oh, Mom, you don't know how to use your phone and you want to upgrade? But on the other hand, I can sit there and say, look, I know how to hem a skirt and you don't, So, let's look at those opportunities.
I was just wondering if you thought that the breakdown of the extended family has anything to do with ageism today, because children don't grow up with their grandparents anymore. They don't have older people around them that much. So they're not used to them and they look at them differently.
So this whole issue of extended families is real interesting, and it's a trend that's been ongoing for quite a while, and not just in the United States, but actually throughout the entire world. Some countries more than, some societies more than others. We are a more mobile lot than many of our parents and grandparents. Although I must say, at least where I live, there's an awful lot of people that I know whose grandparents were not born in the United States, and so they were pretty mobile, frankly, a lot more than some of us. But some of us didn't grow up in families where everybody had to work, and some of us didn't grow up in families where you lived so far away from one another. And frankly, some of us grew up in families that were a lot bigger and there were a lot more kids. And so things have changed. And I think it does have an impact. And if you live, especially now in our sort of dialed in worlds where you can basically interact both in real life and in virtual life with people who are pretty much like you, sort of like living in a world of mirrors where, what you hear on TV is the kind of voices that sound like yours, and the kind of people that you see are the kind of people who look like you. It's easy to do that. And how much we lose in terms of the richness of our lives, and how much we lose in terms of the ability to empathize and frankly to prepare for and to learn from people who are kind of a step ahead of us on this path of life. So now we need to be a little more intentional about it. We need to build in opportunities, as the previous question said, for us to do things for one another, to learn from one another. I didn't really talk about time banking, but the whole idea of time banking, the idea that of people who live in a neighborhood or live in a community, everybody, no matter what their age or what their ability, has something they need and has something they can offer. What you offer may just be something like being able to talk about, able to tell a story for an hour about what it was like to live in Fort Collins 60 years ago, what the roots are, or whatever it might be. But you have something to offer, and everybody has something they need. And if you begin with that, then things build from there. So I agree with you. Times have changed. Traditional families are not the only way of doing it. And more people, especially as we get older, and frankly, more women than men, because of the demographics, are asking, well, how do we want to get old? And if it's not going to be with a traditional spouse or partner? Where do I want to live, and how do I want to live, and who's going to take care of me if I can't trust my no good kids to really take care of me? How am I going to take care of myself? So it prompts a lot of new questions, but real important ones.
And the only thing that I would add to that, because I think family structures are something that we are going to have to struggle with to ensure the connections within families and within the communities. But on the issue of ageism, you know, I struggle as I open up magazines and I look through the newspaper and I watch the ads on TV, which I try not to watch that much TV, because it's all anti-aging. You know, what can you do to look young? I don't want to look young. I want to be healthy. So I think part of this, again, is to get rid of that anti-aging and to just embrace age. In saying that, I think that's something that we all need to stand up and say, you know, I'm not gonna accept this. You need to change your marketing.
Most of us were raised in an era where you didn't ask for help. You were raised to be self-sufficient. And now we're telling the people who are our age, older, and coming up, ask us. We'll be willing to help. How do you get that out to those people and to us that say, yeah, it's okay to ask for help. It doesn't mean you're weak.
Well, I'll just start out a little bit on that. We are working with the National Council on Aging on a campaign. We launched it before, and we're starting it up again, called You Gave, Now Save, which is really focused in on the fact that looking at the fact that there's so many different governmental benefits, but ones that you paid into, and it's not, and what you're asking for is what you deserve. It's what you've paid into when you're looking at Social Security benefits and the like. So that's one thing, is to reconstruct and reframe the way that we look at services and benefits. On the other part of the services side is, again, what we found on the delivery of person-centered services is that if you ask people what they need, they will actually say they need a whole lot less than what you would have given them otherwise. So I think that is another part of it, is to be able to define, we can do something to help you. The other part is the engagement part. You know, I was talking to somebody in the room, and I don't see her right now, who is a minister here in the community, and was talking about the fact that she has a lot of very old members of her congregation and some young families, and how to blend the two of those, because there might be a little bit of tension between the two as far as, you know, having kids in the service and the like. And what I'm sitting there saying is, okay, how many of those older people in the congregation need a ride to church? And that young family could do that. And how wonderful would it be for that young family to have an hour of babysitting? You know, so how, you know, again, coming back to that communication and connection.
And I would just add one thing real quick, and that is, it's the previous point, we tend to sort of divide people by age. And, you know, that old person who needs a ride is me tomorrow, you know, and do I want to be sort of, you know, stuck in my own home, unable to get to church? Or do I want, you know, to be still valued as part of my community and somebody to think about, hey, where's Andy? We haven't seen him for a while. And so maybe if I help Sandy today, somebody else will help Andy tomorrow. It's just part of being human.